It is my distinct pleasure to introduce Monica Wojcik, who Anna Donna Luria and I nominated for the Michael Watson Genetic and Genomic Medicine Innovation Award. Monica is a clinician scientist trained in both pediatrics and neonatology, and she's worked in our rare disease group for nearly a decade and now has a faculty appointment at Boston Children's Hospital, Harvard Medical School, and the Broad Institute. Among her many accomplishments, Monica has spearheaded work to bring implementation science-based approaches to improve diversity, equity, and inclusion in our rare disease genomic research, and this has made a huge impact in our ability to bring diagnoses to all individuals. She's also made major contributions to discovering the causes of rare disease with novel gene discoveries, as well as an understanding of the basis of infant mortality. She has been prolific in her ability to write and publish impactful papers, including a recent New England Journal of Medicine paper on the contributions of genome sequencing over exome sequencing. Overall, Monica has a unique ability to see the bigger picture of genomic research and bring together large groups of collaborators with a shared vision. And this is the kind of attributes that really allow our work to be more impactful in the field. And overall, I just have to say that it's been a joy and a reward to have Monica in our research group and see her impressive accomplishments as she's transitioned to an independent researcher and now leader in genomic medicine. We cannot think of a more deserving recipient of this award. Congratulations, Monica.
I'm so incredibly honored and really humbled to receive this award, particularly considering the legacy of Dr. Watson. To me, being a doctor is about working to improve health and quality of life for the families that I care for, and access to healthcare is a critical part of that mission. We're not truly realizing the dream and promise of genomic medicine if everyone isn't able to access and benefit. And health equity, to me, at its core, centers on doing the right thing. As a clinician, we see that there are families who face barriers to care for many reasons, and I think there's a moral imperative to address those barriers. And in order to do so, you really have to understand them, not necessarily from my perspective as a clinician or researcher, but really from the perspective of the person you're caring for and their family. What an amazing world we're in currently, where we can identify the precise genetic diagnosis prenatally or within the first few days of life. And we can tailor care depending on that diagnosis, whatever that looks like for the family. I feel like my day-to-day world as a genetics researcher and clinician is filled with, amazement and wonder at what we can do, but also determination, given that there's so much that is left to be done. Although we can diagnose many families faster, more efficiently, I'm commonly reminded that at least half of people with rare conditions remain undiagnosed. So there's still a lot we don't understand. So that's only on the diagnostic side, but then thinking about clinical implementation, how to best use these technologies to improve health and truly benefit families in a meaningful way. Underlying all of this is equity and justice, access to genomic diagnostic technologies, access to therapies, access to a better future. And I think that again comes down to, what's the right thing to do. We can't develop a system that's only helpful for certain types of people. And so I think a part of everything that I do relates to creating a process that's just, equitable, accessible, and that's always going to be what drives my work. I'm always humbled to see these applications of advances in genomic technology that are rewarding for me as a physician, and yet the family doesn't feel like they've benefited much at all. And I think this is a call for all of us to really do better, to understand what people need and want for their own health and quality of life. And I think then the onus is on us as researchers and clinicians to figure out how can genetics and genomics help people realize these goals. And again, not how can we help people only with those people with the most resources, but how can genomic medicine reach everybody in a meaningful way? So this aligns with what I love about being not only a geneticist, but also a neonatologist. I love being able to be there for families throughout their journey, which may begin even before a baby is born. So in genetics, we talk about the diagnostic odyssey, but parenting is truly an odyssey as well. And I think that's one of the things that is really special about the intersection of genomic medicine and neonatology, to be a helpful and supportive part of that journey. So as a geneticist, neonatologist, a pediatrician, I feel that access to genomic medicine is a critical part to helping families to achieve a better future for themselves and those they love.